Hello everyone, welcome to SK Nursing Notes. Today I again come with a topic of genetics which is prenatal development and common genetic disorder. First of all, prenatal development. Prenatal. These words means the before the period of delivery. मतलब डिलीवरी के पहले का जो पीरियड रहता है from the conception to delivery, it is called prenatal. So in the prenatal development it is divided into two parts. One is mitosis and one is meiosis. In the mitosis cell division, in the cell, the chromosome number is 12, and in the meiosis cell division, the number of chromosomes in the cell is 8. A genetic disorder during this prenatal period mainly in the three types. One is chromosome number abnormality, another is chromosome structural abnormality, and genetic mutation. Chromosomal number abnormality. This means in the human body there are the 23 pairs of chromosomes is present. 22 pairs of chromosomes and 1 pair of chromosomes is separated. The number of the chromosomal abnormality is occurs, and for that different type of disease can occur. First of all, chromosome. Chromosome means one chromosome in the body is absent, which is Turner syndrome, where the one X chromosome is absent and the total chromosome number is 45. Then trisomy. In the trisomy, Klinefelter syndrome and Edwards syndrome, Down syndrome. In the Klinefelter syndrome, one X chromosome is extra present in the male and the chromosome number is 47. And in the Edwards syndrome, the trisomy 18 is occurred, and in the Down syndrome, the trisomy 21 is occurred. Then tetrasomy, there the 4 number of chromosomes present, and metasomy, there the 5 number of chromosomes present. Next, chromosomal structural segment. This is two types. One is reciprocal and one is Robertsonian. In this condition, the part of the chromosome segment are translocated and exchanged between two chromosome types. In the reciprocal chromosomal translocation occurs between the two short arm and two long arm, and in the Robertsonian translocation between two short arm and between two long arm. This is called the translocation. Then deletion. Deletion is the condition in which the part of the chromosome is deleted. This is called deletion. Then microdeletion. In this condition, the small gene or very small part is deleted from the chromosome. It is called the microdeletion. Then Prader-Willi syndrome. In this, it is a genetic disorder caused by the abnormality on the chromosome of 15, specifically the 15, Q11 and Q13 region. Due to deletion of the 15 number chromosome, this Prader-Willi syndrome can occur. Next, gene mutation. Gene mutation means a permanent changes occur in the DNA sequence of a gene. This is called gene mutation. This is three types. One is autosomal dominant inheritance. In this condition, gene will be expressed and suppress the recessive gene. It express when they both homologous and heterogeneous. In this condition, 50% chance to be affected in this generation and 50% will be healthy. So the conditions are achondroplasia. Achondroplasia means short limb dwarfism, which is this condition, and ectrodactyly means split hand and foot. In this condition, ectrodactyly, which is split hand and foot. Then polydactyly, presence of extra fingers, and osteogenesis imperfecta. In this condition, fragile bone and break easily. These conditions is present in the autosomal dominant inheritance. Then autosomal recessive inheritance. In this condition, 50% chance to be carrier and 25% chance for affected, and 25% will be normal in this generation. The conditions are cystic fibrosis. In these conditions, thick sticky mucus block the airway and also the pancreatic and bile duct. This is called the cystic fibrosis. Then childhood spinal muscular atrophy. In this condition, this is the genetic disorder characteristic by the progressive muscle weakness and wasting due to the degeneration of the motor neurons in the spinal cord. In this condition, the structure of the baby is abnormal. In this picture, the spinal cord is deviated and the muscles are not formed properly. Next, Tay-Sachs disease which progressively destroy the nerve cell in the brain and spinal cord. This is called Tay-Sachs disease. Then phenylketonuria. In phenylketonuria, commonly known as the PKU, is an inherited disorder that increases the level of a substance called phenylalanine in the blood, which is characterized by impaired brain development and intellectual disability, behavior problem, and microcephaly and epilepsy. These are the sign symptom of phenylketonuria. So these are the autosomal recessive inheritance. Then we know about the X-linked inheritance. In the X-linked inheritance, the disease condition is transferred by the X chromosome. First of all, Rett syndrome. It is the near neurological disease which is affected the girl child, where the characteristics by impairments in ability to talk, walk, eat and breathe, and also repetitive hand movement like flapping, closing of hands, etc. This is called the Rett syndrome. This is a neurological disorder and occur in the young girl. Next, hemophilia, a mutation or change in one of the gene that provide the instructions for making the clotting factors needed to form a blood clot. Means hemophilia is the blood clotting disorder in which the bleeding can occur and do not stop earlier. Then muscular dystrophy. In this condition, it is the progressive muscle weakness and typically in the boys it can occur. Then fragile X chromosome. Fragile means easily break down. So this is the X chromosome disorder where the chromosome and genes are easily break down. And other genetic disorder like sickle cell anemia, in which the hemoglobin or RBC is look like the sickle cell and the anemia can occur. Then thalassemia, this is the mutation of the gene for the hemoglobin formation, so the decrease of the hemoglobin level in the blood. And spinal bifida, it is the genetic disorder in which the closure of the spinal tube is not occur properly, so this is called the spinal bifida. And causes of these genetic and chromosomal dysfunctions. First of all, teratogens. Teratogens means any substances which come in the pregnancy and cause the chromosomal abnormality, genetic abnormality of the babies. It is called teratogens. Like any type of the medicine, any type of the infections, maternal genetic conditions, and maternal illness also called teratogens. Then maternal diseases like rubella, blindness, deafness, and brain damage. These can occur in the child. Then chickenpox and mumps. These can cause birth defects and miscarriage. Syphilis and gonorrhea. These can transmit to the child. Then also AIDS and herpes simplex virus also cause the deafness, brain swelling, mental retardation, etc. Then maternal drug use like the aspirin which lead to bleeding, thalidomide caused the missing limbs, and marijuana restrict the oxygen to the fetus, and methamphetamine is linked to low birth weight baby and neurological impairment. And also cocaine, alcohol, cigarettes, these also disturb the development of the fetus. And also occur the fetal alcoholic syndrome. This is the disorder caused by the pregnant mother consuming substantial quantities of alcohol during pregnancy, potential resulting the mental retardation and delayed growth and facial deformities. These are the teratogenic effect on the fetus. Then what are the environmental factors that affect the prenatal development? First of all, microbiomes like the virus, bacteria, microbial exposure. These all the factors are tissue effect of the baby and also delay the development of the baby. And also smoking, antioxidants, folic and vitamin deficiency, dietary fibers and probiotics deficiency, and also the allergens and pollutants. These are interact within the baby's growth, and also the prenatal influence and neonatal immune immaturation and prenatal influences, which is development of the different phenotypic and allergic disorders in the babies. So the environmental factors and agents which that cause the prenatal genetic effects, like the gestational periods like first 2 weeks of gestation, where is embryonic death, chance of embryonic death is high. Then week 3 to 8 of generation, multi-system congenital abnormalities chance is high. Then week 9 to 38, most tissue that have differentiated, and the brain of the most susceptible. These are the chance in these weeks. Then uncooked meat, eggs, and unpasteurized milk, which can cause the hydrocephaly. Hydrocephaly means excessive fluid accumulation in the brain and brain. Then microcephaly, small brain, and cerebral palsy. These can occur due to this condition. And cytomegalovirus, herpes simplex virus, varicella, and HIV and syphilis, these can cause the microcephaly. Microcephaly means small head than the body structure. Then rubella infection affects the first trimester, which is can cause the visual, auditory, and CNS dysfunction in the baby. Then how to prevent this teratogenic effect? First of all, vaccination. मतलब जो इन्फेक्शन हो रहा था जैसे कि रूबेला, साइटोमेगालोवायरस, इन्फेक्शन शुड बी टेकन. And folic acid dosage. Folic acid prevent the neural tube defect. So folic acid dosage like 400 mcg per day should be taken. And avoid unnecessary medicines, and don't smoke, don't drink alcohol, which may cause the delayed development of the baby. Avoid all illicit drugs, get exercise and plenty of rest, and get early and regular prenatal care. These are the preventive measures which is taken by the in the pregnancy and can prevent the teratogenic effect. Please like, share, and subscribe my channel.